or too much sexual intercourse in men will deplete your chi. Chi, that's your life energy. Prevention is actually cheaper than hospital bills. If you have low levels of testosterone in men, you are likely to have issues to do with the infertility. You won't be. Excessive amounts of beef can actually expose you to prostate issues. So you have to take it in moderation. So what we call sadza nowadays isn't real sadza. Real sadza comes from the small grains. The small grains used to pass through what we call a grinding stone, guyo. As men, we reach andropause a bit earlier as compared to women.
Hello, Wisdom and Purpose family. Thank you so much for wisdoming and purposing with us. ImeTheFinest here. As requested, we are covering a health topic before the end of 2025. So today we are diving into the raw and often unspoken topic of men's health. So joining me on this platform on this episode is Dr. Richard Mutingwende, any acupuncturist and registered homeopath. I hope I pronounced it correctly.
Acupuncturist.
Or acupuncturist.
Yes,
Yeah, okay.
yes.
My health terms, my terms, but anyways, thank you so much for joining me. How are you?
I'm very well. Thank you for having me.
I'm really honored to have you here. All right. So firstly, let's clarify the terms. What do you do? What's the meaning of these terms?
Well, I practice what we call Chinese medicine, Chinese medical system, which is acupuncture. I'm sure you've seen it like in the Chinese movies. So acupuncture, that's a medical system whereby we treat a range of medical conditions from back pain, be it herniated discs, compressed nerves, pinched nerves, perhaps you have sciatica, or you might have digestive problems like irritable bowel syndrome, you have constipation or ulcers, or maybe you are struggling with the hormonal imbalances like polycystic ovary syndrome, or you have issues to do with the low testosterone in the body, infertility. So it's a complete medical system whereby we use sterile fine needles to initiate the body or to stimulate the body to heal itself. So the idea is to make the body heal itself without the use of drugs, without surgery. So it's actually a natural way of healing. That's acupuncture. And then homeopathy is also a natural form of treatment whereby we use highly diluted substances derived from nature. Then homeopathy is holistic, meaning it treats the physical body, the mind, as well as the spirit. Just like acupuncture, it's holistic. It also treats mental health issues like depression, stress, anxiety, panic attacks, Alzheimer's diseases, epilepsy, and so many.
So what's the difference between acupuncture and the Western medical
Okay,
thing?
so there's a difference. The Western medical approach, which we all know, addresses like symptoms. Let's say you have high blood pressure, you are put on medications to manage the symptoms. Whereas the holistic perspective, which is acupuncture and homeopathy, aims at identifying the root causes, identifying imbalances in the body, and restoring balance in the body. We understand that what's causing diseases in the human body isn't like a virus or a bacteria, but it's an imbalance in terms of your body energy levels. So the idea is to identify where there's imbalance, we strike the balance. And then when it comes to homeopathy, the idea is to dig down to the root cause. Why do you suffer from high blood pressure? Is it because of your lifestyle? Is it because of mental stress? Is it because of heredity? So it's different from the Western approach, because the Western approach, the focus is on managing symptoms, whereas the Eastern approach, the focus is on identifying and eliminating true causes. And also it's holistic, meaning it's not just a focus on the physical body or the physical aspects, but it also focuses on mental, spiritual, psychological, emotional, because we believe a human being isn't just the physical being. We are also emotional beings, we are psychological beings, we are emotional beings. So it takes a holistic approach. So you find the main difference between the Western approach and the Eastern approach is how we diagnose diseases, how we treat them. From the beginning, the way we diagnose is different, and also the treatment is different.
All right, so let's dive deep straight into our topic. We are talking about testosterone. What are the symptoms of low testosterone, and what are the causes of it?
We normally refer it as a male hormone, the testosterone. That's a male hormone. So if you have a low testosterone in the body, you come across quite a number of signs and symptoms, be it the physical signs and symptoms, be it something which is emotional because of low levels of testosterone. Starting from the physical telltale signs of low testosterone, you may have like a loss of hair, like baldness. Just having a manza, it could be a sign of low testosterone in the body. And also you may have that fatigue, just feeling weak, weakness of the body. That's a good sign of low testosterone in men. In terms of your moods, you might be a bit irritable, become sort of aggressive. That's another sign again. And so you find a lot of men, they struggle with this issue of low testosterone because of so many things, because of our eating habits, because of our lifestyle. So you also find this testosterone is a male reproductive hormone, meaning if you have low levels of testosterone, you struggle with the issues to do with the erectile dysfunction. Like nowadays, it's very common. A lot of men, they struggle with the erectile dysfunction. Like I said, it's because of our eating habits, because of our lifestyle. You also find an issue to do with the loss of muscle. If you have low levels of testosterone, you have a low loss of muscle in the body. So there are so many things that can actually point that you are struggling with the testosterone. And then when it comes to the causes, like I said earlier on, the main focus when it comes to holistic therapies is to do with identifying and eliminating the cause. We want to find out why you have low testosterone in the body. Is it because of your diet? Is it because of your lifestyle? So when it comes to the causes of low testosterone in the body, there are simple things like lack of sleep. If you deprive your body of good quality sleep, like you sleep less than 7 hours per day, you have low testosterone in the body. Or maybe you are struggling with the stress, especially if you have chronic stress. We know very well that when your body is under stress, it releases what we call stress hormones like cortisol. So cortisol will simply suppress testosterone. It means if you have high levels of cortisol in the body, the levels of testosterone goes down. So that's another possible cause when it comes to low levels of testosterone, the issue to do with the chronic stress. I know a lot of men, they come across issues that are very stressful in life. So that's another reason why men come across low testosterone levels. And then the other issue is to do with our eating habits. Like nowadays, people, they now focus on the highly processed foods, the fast foods, the junk foods, unlike in the past. So you find if your diet is centered on too much starch, too much carbohydrates, especially the carbonated beverages, they are very high in terms of sugar. It lowers your testosterone levels. Then when it comes to the highly refined carbohydrates like bread, like refined rice, baked goods, all these foods, they can actually lower your testosterone levels in the body. And then when it comes to other things that we use on daily basis, this is very, very important. They are what we call endocrine-disrupting chemicals. The endocrine, that's the system responsible for regulating our hormones in the body. That's the endocrine system. So there are issues like cosmetics, even the body care cream that you use, sometimes it suppresses the production of hormones in the body. There's also an issue to do with exposure to chemicals. It could be exposure to pesticides. This will also interfere with your endocrine system. It could be pesticides in the vegetables, in fruits. They will all interfere with the endocrine system in the body. So there are so many things, including plastic bottles. You know, nowadays you find water is bottled in plastics. The carbonated beverages, they are all in plastics. So there are chemicals that will actually leach in plastics, like what we call bisphenol A. So the moment you take like a plastic bottled water, or you take any beverages in plastics, you're likely to struggle with these issues of low testosterone in the body. So there are so many things that can actually result in low testosterone in the body.
Alright. Doc, so what food should we eat?
Yes, like we say, let food be your medicine. When it comes to most of these Eastern medical approaches, be it Chinese medical system, be it Ayurveda or Homeopathy, you find the main focus is on what we put in our body, because we believe food on its own is actually medicine. And sometimes what we eat can be the slowest form of poison, meaning there are certain foods that are good for the body, and there are certain foods that can actually heal the body. When it comes to low levels of testosterone, the best way you can actually boost such levels is by taking the correct diet, especially foods that are rich in zinc. Zinc is a key mineral in the body, especially in men, because for your prostate to function, it requires zinc. For you to have high levels of testosterone, you need zinc. So you find zinc in mushroom, all types of mushroom, be it mushroom from the bush or this oyster mushroom. It's filled with zinc. You also need like pumpkin seeds. In the past, people, they used to call it mtetenerwa. In fact, they used to make it relish, just to eat sadza with the pumpkin seeds or with the watermelon seeds. The idea was to derive all the nutrients from the seeds. So you also find zinc in a variety of seeds, be it pumpkin seeds, watermelon seeds, or a variety of nuts, the cashew nuts, the ground nuts. They are all filled with the zinc. Another key mineral required by our body in order to boost like the reproductive system is iron. It's required in our body, of which you can also get iron and high levels of testosterone in beef, but you remember to take it in moderation. I know a lot of men, they love like braising and so forth. Excessive amounts of beef can actually expose you to prostate issues. So you have to take it in moderation so that you boost the levels of testosterone in the body. You can also find something like garlic. It's good for boosting your testosterone levels, and good fats like from olive oil, avocados, they all boost testosterone levels in the body. But remember to avoid certain foods, which I said sometimes what we eat can be the slowest form of poison, especially too much consumption of alcohol. It depletes the production of testosterone. Issues like too much consumption of carbonated beverages, they depletes production of testosterone in the body.
Alright, Doku, does it affect a specific age group or it affects everyone?
When it comes to the levels of testosterone, you find low levels of testosterone are at a peak from your 30s. Of course, it affects all people of all ages, like even the teenagers, they get issues like low testosterone. But I'm saying it's at peak from the middle ages, from the 30s, the 35, people will start then struggling with these issues of low testosterone. But like I said, it's more important to know that from the ages of 30, 35 going upwards, that's when you start having those issues to do with the stressful life events. That's when you start having those issues to do with the like a poor lifestyle. Perhaps you are now taking too much alcohol, too much drinking of alcohol. So it's at peak from the ages of 30s. In fact, some they say, as from the ages of 30s, the levels of testosterone will decline by 1% each year. So meaning by the time you reach 50, the levels are a bit higher. Then by the time you reach 70, it's like you are now struggling with these issues of low testosterone as compared to your middle ages.
Is there any way, except the changing of the lifestyle and your eating habits, is there any way that we can avoid it as we are aging?
We always say prevention is actually cheaper than hospital bills. The main focus when it comes to holistic therapies is prevention. That's number one. So you don't have to wait until you have low levels of testosterone so that you start taking action. You have to start now. Even from as young as teenagers, they have to start taking care of their body, you have to exercise. That's one thing that can actually boost your testosterone levels. So even if you are 30, you are 40, you are 50, find a way that you can actually, it's like become active. You need to exercise. I know one thing that will hinder issues to do with exercise is sometimes it's because of excessive weight. The moment you have that belly fat, sometimes it's a sign of low testosterone in the body. I know a lot of men, they struggle with the with the belly fat, and so sometimes it's actually a sign of low testosterone in the body. And again, it's more important to know that as men, we reach menopause earlier than women. I know it's shocking to many people because they simply know that menopause is for women. So as men, we reach what we call andropause as early as 30, 35. So the moment you reach andropause, it means you have issues to do with the decline of hormones in the body. And then it means you now having that belly fat. I know many people, they associate belly fat with money. If you have a belly fat, they think maybe you have lots of money. Yeah. No, sometimes it's an issue to do with the hormonal imbalances. Sometimes it's an issue to do with insulin resistance in the body. So when it comes to this issue of low testosterone, the best way we can do is actually to prevent it before it strikes. Like I said, you have to exercise, you have to go for the right diet, the correct diet. We have to eat the best food. When I talk of the best foods, I'm not talking of the most expensive foods. I'm talking of natural foods, organic foods, foods that are grown without the use of pesticides. Earlier on, I mentioned that even vegetables that are grown with the use of fertilizers, with the use of pesticides, they can actually interfere with your endocrine system, resulting in hormonal imbalances like low levels of testosterone. And then in women, you find that they will struggle with the uterine fibroids because of these chemicals like pesticides, like chemical fertilizers. So that's the best way you can actually prevent issues to do with the low testosterone. You have to exercise, you have to go for organic foods, you have to go for whole foods. Whole foods, I'm referring to foods that are not processed, like the whole grains, brown rice. All these whole foods, they are good when it comes to balancing your hormones. And again, remember to manage your stress levels. We always say stress, that's the most culprit when it comes to our health issues. Because when your body is under stress, it means each and every system in the body is compromised. Whether it's your immune system, whether it's your hormonal system or your circulatory system, your respiratory system, the moment you have stress, that system is compromised. So you have to find ways to manage your stress levels. The good thing with these Eastern medical approaches, there are so many ways to manage stress. You can exercise. There's what we call Tai Chi or medical Qigong. You can do...
sorry, Tai Chi is a form of karate, right?
No, we call it a medical Qigong. It's a form of, it's on the medical side.
I thought it's the Tai Chi that we all know.
Yeah, that the same Tai Chi that you know is medical.
The combat one.
Yeah, it's medical.
Right, cool.
That's what we call medical medical Qigong. There's what we call Badwan Jin. It's almost similar with Tai Chi. And you can also do meditation, deep breathing exercises, or even yoga. They are very helpful when it comes to preventing issues like stress, which will then cause issues like hormonal imbalances.
All right, Joko, please clarify on this. Recently, I was reading an article which says our White Sadza is not healthy. Is it true?
Well, that's a $1 billion question. What we call Sadza nowadays isn't real Sadza. Maize was introduced here in Zimbabwe around 1928, meaning prior to 1928 or before 1928, people used to consume real Sadza. Real Sadza comes from small grains like rapoko, sorghum, finger millet, zio, munga, mafunde, or even wheat. That's where we find real Sadza. This one from white maize is pulp, right? It's not real Sadza, it's pulp. There's too much starch and too much carbohydrates in maize. Initially, maize was meant for stock feeding. For mombe, donza gejo. But right now, you take a plate of sadza, what we call mkonde we sadza, then you spend the whole day seated. What will happen with those carbohydrates, with those starch, your body will simply convert that sugar into fat. That's why you find many people, they have belly fat, they gain weight, they struggle with weight. You can actually tell that this person is struggling with weight. Even if they wake up each and every morning, they do a 10-kilometer marathon, but you go back to your plate of sadza, it's pointless. So what we call sadza nowadays isn't real sadza. Real sadza comes from the small grains. The small grains used to pass through what we call a grinding stone, guyo. I know many people, they think it's primitive, but the idea was to derive calcium, phosphorus, and potassium from the stone. So that if you grind your corn or your sorghum, it will derive that phosphorus and other minerals from that stone. Even if you grind your peanut butter dovi, it will derive those minerals from the stone. That's why you find in the past people were actually very, very strong. They would walk even 10,000 steps in a single day, but nowadays you hardly walk even 100 meters per day.
Yeah, apa madira toita sadza. But do you think the reason why the rapokos, it's because of the Western guys who are trying to push their agenda?
So that's a good question. Some they say, and dura, and cheaper, dura. You see, meaning that yes, a bucket of meal derived from maize, maybe it's $5. But a bucket of meal from the small grains is $30
or more,
or even more. That's the value. Kura kuti izvi zvakachipa izvi zvinodhura, meaning kuti health wise it will cause many health problems. Okay, so I know many people, they are impressed with the yield. If you grow maize on a very small portion, you harvest like tons and tons of maize, as compared if you grow like the small grains. But it's more important to focus on the health side. Small grains, they are very, very healthy. In fact, if you resort back to the small grains, it's actually a way of preventing these lifestyle conditions. When I say lifestyle conditions, I'm talking to conditions such as high blood pressure. It's surprising nowadays, people for your age, those early 20s, mid 20s, they're now struggling with high blood pressure, hypertension. They now struggle with the type 2 diabetes, which we call a lifestyle condition, a condition that is all to do with our lifestyle insulin resistance. It's because of too much carbohydrates that we consume, especially from these highly processed foods, as well as the sadza. I'm not saying sadza is bad, but we have to go for the right sadza, which is from the small grains.
Alright, please clarify. Earlier on you mentioned about menopause and andropause.
Yes.
Andropause, exactly. Clarify on that one. Isusu tikangonzwa also know andropause, menopause. We think is the loss of appetite for sexual activities. Is it true? And how can we not reach andropause as men earlier?
Okay, so it's important to know that both men and women, they reach menopause, and men, they reach andropause. So in other words, we are saying we all reach menopause, right? It's important to know that it's a natural process. A natural process meaning you can't fast track it, you can't run away from it, you can't avoid it. But when we reach menopause or andropause, there's an issue to do with the hormonal changes in the body. That's why you find in women there's an issue of estrogen decline, whereby they have like hot flashes in the body. They just feel like a wave of heat in the body. They have like weight gain during menopause, especially around the waist. It's because of estrogen decline in the body. And also they have like issues to do with irritability, the issues to do with moods. Same applies to men. Like I said, as men, we reach andropause a bit earlier as compared to women. In women, they reach their menopause like late 40s, whereas in men, from 35 years. So the moment you start having that belly fat, it could be a sign of andropause in men. All right. The moment you start having erectile dysfunction, I know a lot of men have been accused that wakasungwa. It could be an onset of andropause. It could be an onset of hormonal decline, this issue of testosterone. Then you might also have that issue to do with the mood swings, even in men. Irritability. We know the issue of irritability is more associated with the other gender. But sometimes men, they become so irritable, they become so aggressive, they become so weak, and also just feeling fatigue. It could be a sign of andropause or the onset of andropause. So we have to understand that both men and women, there's a time we reach hormonal decline, which we call andropause and menopause, and it's a natural process. You can't avoid it, you can't run away from it.
Or does it affect fertility?
Yes, when we talk of estrogen, when we talk of testosterone, these are reproductive hormones. If you have low levels of testosterone, you won't be able to conceive. It's like you have low sperm count. I know when it comes to these issues of fertility, especially in our culture, we think it's just for women. Like if a couple, they fail to conceive, they say mukadzi ngadzokere kumusha kwake because haazvari. They think kuti mukadzi ndiye anoita sei, ndiye chete anoconceive. So it takes a men and women to conceive. So if you have low levels of testosterone in men, you are likely to have issues to do with the infertility. You won't be able to conceive, of which there are so many things that now that will cause low levels of estrogen, of testosterone in men. Like for those who love like taking hot baths, hot showers, it causes low levels of testosterone, low levels of low sperm count, you see. And also if you over-exercise, earlier on I said it's good to exercise, but if you over-exercise, this will also cause issues to do with the low testosterone in the body. So these issues of low testosterone and issues to do with the estrogen and hormonal imbalances are the pillars when it comes to conceiving. So you might struggle with fertility because of these hormonal issues. But like I said, you have to dig down to the cause. Why are you having these hormonal issues? Is it because of mental stress? Is it because of your diet, your lifestyle, what you eat, everything? You have to come down to the root cause.
All right, Doc, what do you think about testosterone replacement therapy, and what are the side effects?
Well, so I wouldn't want to talk much about that testosterone replacement therapy because it's more of the Western side.
Wow.
But what I understand is that when it comes to artificial, when I'm saying artificial, it means if something is replaced in your body, whether it's insulin injected in the body or whether it's testosterone injected in the body, that's not the natural testosterone, that's not the natural insulin. So it's something sort of artificial, right? So when it comes to putting something artificial in the human body, remember our body is a natural body. It's obvious that you may come across signs and symptoms. You may come across like side effects of that. So you might have an issue to do with the shrinkage of your testicle, of your testes. They may actually shrink. Just like those who take like those steroids, anabolic steroids, the bodybuilding, their male organ will actually shrink because of steroids. So just like any other chemical which is foreign to the human body, you are likely to come across one or two side effects because of hormone replacement therapy.
All right, so I'm 40 years, I'm 50 years, I have low testosterone levels, and I want to fix it and to boost it. What's the best way to do that?
Well, so that's when acupuncture comes in. Remember, acupuncture is there just to assist the body to heal itself. In your body, there are more than 365 points. So we know very well if we activate this point, your body will actually boost testosterone levels. If we activate this point, this will help to relieve stress, anxiety, which is causing low testosterone levels in the body. So acupuncture, that's the first thing you can try. And also you find there are so many homeopathic medicines that can actually help when it comes to boosting your testosterone levels. Like I said, it's more important again to dig down to the root cause. Why do you have testosterone levels that are very low at 40 years? Is it because of your diet? So we have to focus on your diet. Perhaps you are a drinker, you take too much alcohol, or you are a smoker. So there are certain habits that you have to kick away so that you boost your testosterone levels. There are certain foods that you have to avoid. Perhaps you take too much of these carbonated beverages or highly processed foods, the foods that are preserved with sodium nitrates like the cured meats, you have to avoid them. Then you go for the foods like the ones that I mentioned, the mushroom, the pumpkin seeds, garlic. We know such foods, they can actually boost your testosterone levels. And again, if you have chronic stress, manage your stress levels. If you deprive your body of good quality sleep, you have to sleep at least 8 hours in a single day. So the most important thing is to identify where the problem is, why you have low testosterone in your body. That's the most important thing. Then we say you have to identify and then eliminate the cause. Identify the cause and then eliminate the cause. Then you are free from your problem.
All right, please clarify on this one as well. I heard many people saying also isusu vanospenda almost our day on the screen zvinoreduce my testosterone levels and zvinokanganisa our health. Is it true?
That's very true. I always say when it comes to a modern way of living, like the use of electronic devices, electronic gadgets, it's not only the issue of straining our body mentally, but sometimes even exposure to radiation. Many of these electronic devices, they emit radiation to the body, you see. And also you find spending much of your time on screens, not just for men, for people of all ages, even for kids. That's why you find for certain kids, they will struggle with eyesight. Some will have issues like epilepsy because they spend much of their time focusing on screens. So that's very true. If you spend much of your time on screens, this will affect the whole body. When I say the whole body, I'm not just referring to the physical body. I'm also referring to the emotional, the psychological, and the mental.
Alright, how far is it kuti ukaisa munhu wechirume afanoisa foni muhomwe because it will affect?
So not just munhu wechirume, even women. Like I said, these electronic devices, they emit radiation, especially our phones. Have you realized that if you sleep like very close to your phone, you may have a headache? You're struggling with headaches. I've come across many people who always complain of headaches. Some they say, I've got this migraine headache. But when we say, now let's dig down to the root cause, what's causing your migraine headache? Is it hormonal imbalance or let's find the triggers? Sometimes we identify your phone as a trigger. Your phone is actually triggering your headache. So it's very true because these electronic devices, they emit radiation, and this radiation has an effect even to our reproductive system, even to the endocrine system. So that's very true. I've seen even women, they put like their phones in their bras. It's exposing your body to radiation, which is actually carcinogenic. It can actually cause cancer.
Alright, let's talk about prostate cancer. During the pre-colonial era, I haven't heard anyone who died of cancer. So what are we doing wrong?
Yes, we are doing it wrong. You are very right. You are very correct. During the pre-colonial, there's this issue what we call colonization. Many people, they think colonization is to do with the grabbing of assets and resources. But there's also an issue to do with eroding our culture, our traditions, and everything. So in the past, there were very few people who used to struggle with these modern diseases like prostate cancer. Earlier on, I mentioned that in the past, people, they used to get their food in the field. It passes through a grinding stone, then they consume the food. Like nowadays, we just go for the fast foods, the junk foods. I mentioned earlier on that even the bottled water can actually cause low levels of testosterone. The reason being that there's this issue of colonization, which I said, we have to decolonize our minds. When I say decolonizing our minds, I'm not saying we have to revert back to the old traditions or old ways of living. I know each and every person is now suffering from those effects of colonization. Like right now, if I bring a clay pot of water and a plastic bottle with water, what would you take? Obviously, you will go for the plastic bottle because this clay pot is associated with the witchcraft. It's because our culture, our tradition has been demonized. So that you think anything pertaining to our ancestors, to our old ways of living, to our traditional diet, it's demonic, it's evil. That's why you find when it comes, earlier when we were talking of the traditional grains, very few people will consume such foods because it's associated with the older generation.
I'm included in that one because I didn't.
You see now. Then when it comes to drinking water from clay pots, you know, it has a therapeutic effect to drink water from a clay pot because a clay pot is made from the soil. Remember minerals like iron, like copper. So if you store your water in such vessels, you actually have those minerals. Remember, sometimes the cause of low testosterone in the body is a deficiency in terms of minerals. You hardly find such minerals in foods. A good example is calcium. You hardly find calcium in many of these foods. Unlike in the past, you would actually derive from nature, from stones, from the fields, from the homegrown foods. So it's like somewhere along the way, we lost our natural way of living. Hence, we have many diseases.
All right, let me catch you there. How can we decolonize our mindsets in general and our medical institutions in particular?
Well, that's a very good question. Decolonizing our minds. In fact, you need to go to a school to decolonize your mind. It's like, let's say in every institution, be it a tertiary institution, you have that subject of decolonizing your mind. When your mind is decolonized, you start to have like realizing that we have abundance of nutritious foods. We have abundance of resources. So it's actually something that is very important to decolonize the mind. Sometimes we argue that, no, I'm not colonized, but the way we are living is more inclined to the Western ways of living. Hence, we are now having so many diseases. It was rare in the past to find someone of your age struggling with high blood pressure. Nowadays, at our practices, we come across people of your age, the mid-20s, with prostate disorders. Just imagine, with diabetes. It's because of a Western way of living. Our diet is now centered on the Western. It's very important to eat what we call the constitutional heritage foods. Constitutional heritage foods, I'm referring to foods that are compatible to your genetic makeup. If you have a breakfast like mbambaira and tea, it's compatible to your genetic makeup. But if you have pizza, it's not compatible to your genetic makeup. So you're likely to have insulin resistance because of your ways of living. Like you are now eating something that is not compatible to your genes. That's why you find many people right now, they have this what we call lifestyle diseases. Even this issue of prostate cancer, it's a lifestyle disease. Diabetes, high blood pressure, arthritis. We used to say, ma 70 years, 80 years, high blood pressure, not those with the 20 years.
All right, let's continue with this topic of prostate cancer. Is it true that too much ejaculation will reduce the levels of prostate cancer?
Yes, so people have to be very careful. They have to be very careful with those funded researches. Some of these funded researches, they are meant to depopulate certain races.
Oh, yeah.
You see, I studied the Eastern approach. In the Eastern approach or in the Eastern medicine, we say too much ejaculation or too much sexual intercourse in men will deplete your chi. Chi, that's your life energy. Too much intercourse will deplete your Jing essence because we believe the kidney That's the reproductive organ in men in Chinese medical systems. So too much intercourse will shorten your lifespan, will reduce the quality of your life, will deplete your chi. The chi, that's the life energy that I'm saying. So I know a lot of people, they are now saying there are these latest researches saying if you have too much ejaculation, you will prevent these issues of prostate cancer and the like. That's why I find many people, they are now resorting to mujolo, what they call mujolo. They are trying to do that. They are trying to prove it wrong. At the end, you will suffer.
I almost believed it because for all the guys I know who are polygamous, I haven't heard anyone dying of these diseases.
Okay, so when we look at the population, those who are polygamous, they are very few. They are very, very few. So we can't really say it's true. Or let us just say the researches are still inconclusive because there's no truth at the moment. I know our forefathers, or like my grandfather, used to have like 13 wives. 13 wives, and he died at 100 years. But that's not a proof that if you have many wives, you can actually live longer. Like I said, in the Chinese medical system, they believe if you ejaculate too much, your lifespan is shortened.
All right. So before we move on now, what's your take on masturbation? And does it affect fertility? Does it affect testosterone levels? Does it affect prostate?
So I can simply classify that as a mental health issue, the issue of masturbation. Sometimes it's to do with how you were raised. Sometimes it's an issue to do with the low self-esteem, you see. And there are so many effects when it comes to masturbation. Like there's an issue of these issues of hormonal imbalances. There's an issue of just feeling fatigue, general fatigue. The issue of guilty. Like I said, when we talk of the human body, it's not just the physical being. There's also that spirit inside, that mentality, that psychological aspect. So sometimes those who suffer from masturbation, I've come across so many people who come for treatment. It's like sort of an addiction. So many people, they struggle with masturbation. I can actually say it's sort of a mental health issue because I've seen many people coming in the same way I treat someone with a drug addiction. That's the same way I treat someone struggling with masturbation, and they get much better. I boost their morale, their self-esteem, their confidence. Yes.
Well, how do you do that?
So when we do acupuncture, we do it on the body, right? There are certain points that can actually help either to relieve stress in the body, to calm anxiety, to boost your hormones in the body, or to treat a particular condition. So it's like a prescription. Each point on your body has therapeutic effect if that point is stimulated. So I know the point to stimulate. If let's say you have an addiction, there's a point that we call snuff box here. That's the snuff box. So if we do acupuncture here, whether you're taking drugs or you have any sort of addiction, you will feel much better.
Please clarify on this one as well. Does riding a bicycle, motorbike, etc. affect prostate?
During my years of practice, I witnessed the true death of my patients who used to be riders, those bike riders. So I believe if you are a rider, there are chances of having issues like prostate disorders. Why? Because there's a restriction of blood flow to the prostate, especially if you ride a bike. Though I'm not sure with the scientific side, but based on my experience as a practitioner, I witnessed the death of 2 riders.
All right, let's take a quick short break, then we'll be right back after this. All right, welcome back we are in conversation with the Dr. Richard Mutingwende. Doctor, so what's the solution to prostate cancer? What should we do to avoid it?
So yeah, it's very important to know that prostate cancer, like nowadays, because of a modern way of living, no one is spared. Kana ungori murume chete, you have to start preventing like today. Eh, there's this thing of prostate cancer and prostate enlargement. I know so many people, they confuse the two. Usually when it comes to prostate enlargement or benign prostatic hyperplasia, it's just to do with the hormonal issue, whereby the prostate is a bit enlarged, then you struggle with the emptying your bladder, with the urination. But when it comes to prostate cancer, we are now saying your prostate gland cells are enlarged because of abnormal cells or because of cancerous cells. Just like any other type of cancer, whether it's breast cancer, whether it's prostate cancer, or any cancer, it's just the same. It's an issue to do with abnormal cells in the body. We have to understand how the human body operates. We say the human body is a self-regulating organism programmed to heal itself. So the main focus should be on your immune system. Your immune system was designed in such a way that if you have any abnormal cell in the body, it's supposed to commit suicide before your defense system attacks that cell. We call that process apoptosis, whereby the abnormal cell is supposed to destroy itself. And then if it fails, your defense system, your body soldiers, is supposed to destroy that cell. So the most important thing when it comes to prevention of any cancer, whether it's prostate or breast cancer, is to keep your immune system well boosted. That's the most important thing. How do we then boost our immune system? We have to take the correct diet. We have to manage our stress levels. We have to exercise. It's something that we sometimes take it for granted. When you exercise, it's good for the lymphatic system in the body. The lymphatic system, that's the drainage system in the body. And that's the system where we find your immune system at work. So if you have that sedentary lifestyle, you are likely to have issues like a compromised immune system. Therefore, if you have abnormal cells in the body, they will simply multiply because your immune system is already compromised. So we need to exercise. We need good quality sleep. Sleep for 8 hours per day. It's good for your body. We mustn't take sleeping for granted. It's like you have to spend a third of your lifespan in a sleeping state, so that by the time you reach 75 years, you would have spent 25 years in a sleeping state. Meaning, in 24 hours, you have to sleep 8 hours. If you fail to sleep like 8 hours, you just sleep for 4 hours, you will pay the cost. You will have hormonal imbalances, you will have a compromised immune system, your body will be weak, not just the physical body, even your mental, psychological aspect, the emotional aspect. You become even aggressive because you are depriving your body of good quality sleep. So there are these simple things that we take for granted, and yet they can actually help in terms of prevention of cancers, especially prostate cancer.
Or last year I was working on a story why many don't want to go through some prostate cancer testing. So ndakazomutaura nemumwe doctor akandiudza the way they do the test singati no hakuna mumwe, even me ndikafunga kuti ngade that test ye hakuna imwe test here.
Okay, so I know that a lot of men, they try to avoid that test. I know it. So you can have what we call PSA test, a prostate antigen test, whereby they just take your blood to the lab. Yes, that one I think it's very simple.
Yeah,
unlike the other one.
The other one I was like, no, that one I wouldn't. All right, let's talk about the testicle descent. When should it normally occur to kids? Or
so this issue of undescended testicles, I've seen a lot of families, they struggle when it comes to undescended testicles to their kids, the boys. So the testicles are supposed to descend from the abdomen before birth or 6 months after birth. The latest 1 year. if your child goes for more than a year without two testicles, then you have to seek like a medical review. So it's like it's supposed to happen before birth or at 6 months or even before a year. So it means fathers, they have to check the testes of their kids. They are supposed to be like two balls inside, not just one.
Well, so what happens if it's one? Or what's the name of the condition, and how can we seek treatment?
So if it's one, it means the other one, we call that undescended testicle. It means the other one is still in the abdomen. So it's like there are long-term effects. There are issues like infertility. It can happen because of that, or even the issues of cancer. It can happen because of that. So when it comes to undescended testicles, for a kid like more than a year, like I said, you need a medical review, and the doctors may actually do like a procedure just to address the condition.
But how often is it?
You mean like
does it okay?
Okay, when we look like at the populations, it's very rare, but it's very common like in preterm kids, like those who are born before like 9 months. You find there are 30% chances of having undescended testicles, especially if you have an issue to do with a premature. And also there's 3% in other kids. So yes, of course, there are very rare cases, but it happens. And also when it comes to a medical review, it's just done once. If it's a procedure, it's done once, then it's okay.
All right, let's talk about fertility. What are the causes of male infertility, and how best can we address them?
So earlier on, I said it's good to talk this issue of fertility because many people, they think it's just for women. I've seen many people with the marriage breakdown because of infertility, and then at the end they will accuse the other gender. But you also find conditions such as diabetes can actually contribute to male infertility, or even obese. When you are obese, you are saying you are carrying excessive weight, not just an issue of belly fat, but if you are obese, chances are very high that you have insulin resistance. In fact, the moment you have that belly fat, it's a good sign of insulin resistance in the body. Insulin, that's the mother of all hormones in the body. So the moment your insulin goes out of balance, it means the other hormones, including the reproductive hormones, they go out of balance. Like if you have low levels of testosterone in the body, this will cause low sperm count, of which we know very well that sperm, that's the seed that is required to conceive. So there are so many things that will cause infertility in men, as well as conditions such as hypertension, BP, something that can actually cause infertility in men, including your body weight. If you are overweight, that's another risk factor. So there are so many things that will actually cause, as well as chronic stress. If you have that chronic stress, it's another potential cause of infertility in men.
All right, what are the major things that we must learn about infertility, except the one that we recently mentioned?
What we have to know about fertility, it's like it's actually a process. It's not an issue to do with the sperm and the egg. It's actually a process. You have to have that a viable sperm that has a potential to fertilize the egg. That's number one. And also in women, when it comes to fertility, there are issues of blocked fallopian tubes. There are issues to do with the hormonal imbalances. There are issues to do with the autoimmune reactions in the body. So there are so many issues. So each and every couple who are struggling with the infertility, you find that their cause is actually different from the other couple. That's why I said when it comes to holistic therapies, they are more like individualized. They are more like personalized, because what's causing infertility to one person is completely different from what's causing infertility to the other person. Hence, it's necessary to dig down to the root cause to find out why you have infertility. Is it because you have uterine fibroids, you have endometriosis, Or perhaps you have an issue to do with the low sperm count. The true cause has to be identified and then eliminated. Then the other thing, which is very important when it comes to fertility, remember, when a sperm enters the women, it's something that is foreign. So each time your body receives something that is foreign, it has to fight back. Like your immune system has to fight it back. So it's like the women's immune system has to accept that thing which is foreign. So sometimes it's not compatible. The women's body will reject the sperm, and this will cause infertility.
All right, team, please give a youth advice to women who receive a lot of foreign bodies from different men.
Well, that's a very serious issue. Sometimes we just take it for granted. Like I said, when you get something foreign, like a sperm from your partner, sometimes it will happen that the woman's body will recognize that this is my husband, and then the body won't reject. But if you are getting from different people, this will compromise, or this will confuse your immune system. Hence, you may have an issue to do with your immune system. There's this issue that we call autoimmune. Autoimmune, we are saying your immune system is now confused to such an extent that your immune system, which is supposed to protect your body, is now fighting your body. So you might have autoimmune disorders. There are so many, in fact, there are now more than 100 autoimmune disorders. So it's not highly recommended to have multiple sexual partners. Even in men, I know some men have an excuse that as men we are allowed to have like multiple sexual partners. When it comes to this issue, I'm sure you have heard of uterine cancer in women, right? Men are the super spreaders of uterine cancer in women. Why? There's this issue of HPV, the human papilloma virus, which is sexually transmitted. So it means if you have multiple sexual partners there, you will bring the HPV, the human papilloma virus, to your spouse, to your wife. Then at the end, she will have cancer because of that. So it's not highly recommended to have multiple sexual partners, whether in men or in women.
The way we are built biologically, we can have multiple women.
No.
And also they also say because we can impregnate 30 women within 30 days, but a woman can't.
No. You gave a good example, a good illustration. Let me give you an example. I can't take my key and then unlock your door. It's impossible because my key is only compatible, or it only fits to my door. So that one is out. Of course, as men, you can impregnate like millions of, because each time you ejaculate, like you release millions and millions of these cells, right? But that's not any excuse that as men, we can have many sexual partners. And I know there's this misconception which as men at pair, even at 100 years, I can marry and still conceive. You know, no, that's a misconception. Like I said, as men, we carry what we call Jing essence. We carry life in our body, in our kidneys. So each time you ejaculate, it's depleted. Meaning even your lifespan, it's shortened. So each time you ejaculate, know that your chi is actually what? It's being depleted. And you have to know that this chi goes hand in hand with wealth, with money.
Okay.
If you ejaculate too much, money will actually run away from you. You will chase money. But if you preserve that chi, it's like it attracts wealth from the Eastern perspective, not from the West.
All right, let's talk about also how best can you cure erectile dysfunction, and what's your take on Guchu?
Well, so when it comes to erectile dysfunction, erectile dysfunction is a sign and symptom of an underlying medical condition. We have to understand that. Earlier on, I said many people, they think if you have erectile dysfunction, it's because wakasungwa or amenosha wakaita wakasungwa. Erectile dysfunction can mean you have diabetes. If you have diabetes, like type 2 diabetes, you struggle with the erection. Erectile dysfunction can mean you have high blood pressure. So each time you notice that you now have erectile dysfunction, get checked for diabetes, get checked for high blood pressure, get a lipid profile test to check even your cholesterol. Because for you to have an erection, the blood has to go like in the penile arteries. So if your penile arteries are clogged with cholesterol, then you won't have erection. So when it comes to Guchu, Guchu, I know a lot of men, they try to resort to different things, Guchu or the blue pills, right? Those things can actually destroy your life. Because the person who prepares that Guchu, is he qualified to prepare that concoction? What are the ingredients? What are the dosages? You see, so sometimes you take that Guchu and you are told that Guchu will cleanse your system. After taking that Guchu, you have a running tummy, you have diarrhea, then you think, I'm cleaned. You see? But it's not safe. It will cost your life. Guchu is not something that is safe unless it's administered by a qualified person or by a licensed person. The same applies with the blue pills. We witnessed so many people dying on the spot because of these blue pills. Because the blue pills are trying to widen your blood vessels. And yet your blood vessels are clogged perhaps with the cholesterol. Then the pressure will backfire to your heart. Then you have heart failure. You die on the spot.
All right, as you close, let's talk about our education system. Because if we check Pama universities, the faculty of medicine, it is based on the Western side.
Yes. You find the Western is dominating, not just here, the whole world. Yeah. The Western are dominating. The reason being that many countries were colonized by the Western. So even not just the education system, how we address exactly. This is Western. Our language, it's Western. Our diet, it's Western. So everything is now Western. So I believe it's time to look the other direction. Let's try to look to the East. We learn their ways of living. Why do they have a longer lifespan? Why do they live up to 100 years? And yet our lifespan here is 65 years, 70 years. We have to learn from the other side.
Why should we not look inside in Africa?
That's a very good question. So we have to learn from the outside, from the East, and then we implement what we have here. Like I said earlier on, we have plenty of these natural resources. But if we learn, it's like we open our eyes. Then we start to realize, okay, this mubora watrukungono, it's filled with the minerals and vitamins that can actually prevent high blood pressure. Aya madumba ya tisiri kujigaya do anorapa erectile dysfunction. You see, so we have to learn. Like the Chinese, they have what you call Chinese food. So we must have what you call Zimbabwean food. A typical breakfast, because if I am taking this breakfast, mbambaira madumbe neti, this is a Zimbabwean breakfast. Kana ndiri kudya sadza ne mutetenerwa, this is a Zimbabwean menu. But we have to learn it from somewhere. I know all these countries, they were once colonized. The Chinese have been colonized by the Western, and all these Asian countries, they have been colonized, and we were also colonized. But it's time to decolonize our minds so that we start to see the value in what we have. That way you will be surprised. Many health conditions will just disappear. Our lifespan will go up.
All right, as we come to an end of this program, I want you to look at this camera and give a powerful message to Africans about our medical institutions and the best medical way, the future of medical way.
Yes, so to Africans, you have to smile. You have to be happy that you are in Africa. This continent, it's like a paradise. I know sometimes you may argue You may have different opinions, but we are actually in paradise. We are surrounded with the resources. We are surrounded with the very powerful, nutritious foods. We have plants with very powerful medicinal effects. What we have to do is to start to open our eyes so that we utilize what we have. My dream is to have Africans who utilize what they have to such an extent that we export medicines to other continents, because this country is actually rich. This continent, Africa, is actually very, very rich. So we have to open our eyes. We have to decolonize our minds. I know it sounds like something good to copy other people, like the West End, their ways of living, but let's focus with what we have. Let's utilize what we have so that we move forward.
All right. Thank you so much for creating this time to be with us.
Thank you. You are most welcome. Meet you again.
All right, thank you so much. So let me turn over to our viewers. Thank you so much for watching this far. I really appreciate. Please, if you haven't subscribed, please hit that subscribe button, like, comment, share, tell a friend to tell a friend. But for now, we are out.